everyone. Welcome to Washington Unplugged. I'm congressional correspondent Nancy Cordes. Thanks so much for joining us today. Well, as the health care debate slogs on here in Congress, doctors around the country who are going to be immediately affected by the legislation are finding themselves in the spotlight. Yesterday, President Obama invited about 150 doctors to the White House, all of whom support his plan. Also yesterday, 3 former presidents of the American Medical Association wrote an op-ed in the Wall Street Journal, calling out the White House for not hearing their opposition. Joining me today are 2 doctors who represent that divide among some of the nation's physicians. They are Dr. Donald Palmisano, a surgeon and professor of surgery from New Orleans, and Dr. Mandy Krauthamer, an internist here in Washington, D.C. Thanks both so much for joining me, and I'll start with you, Dr. Krauthamer, because you were at the White House yesterday. Do you feel like doctors have been overlooked or sort of left out of this important debate up until now?
Well, I think we're in a historic time where there are so many facets of the physician community that support reform, in addition to the American Medical Association, American College of Physicians, and my organization, Doctors for America. We've been working for many months to bring the voices of physicians and our members to the health reform process, and I'm so pleased that I could stand with the President yesterday to really demonstrate that physicians are being involved in this process.
Dr. Palmisano, you wrote in the Wall Street Journal yesterday that the president should have invited some doctors who disagree with him to the White House. And you went on to say, I quote, "More government-run health insurance will only lead to disaster," unquote. Why do you say that?
Well, first off, let me say that it's not only my view, but it's the view of the other 2 former presidents, Dr. Johnson and Dr. Plested from California. But it's the view of over 47,000 physicians that have joined with the Medical Association of Georgia and other state medical associations. So we represent a significant number of people who are saying this. The reason it'll be a disaster is that Medicaid gives people insurance, but it's difficult for them to find a doctor. And Medicare is going bankrupt. What we need to do is to let people own their own insurance and give them tax credits and ways that they can control their own destiny. And as far as these insurance companies doing things that we don't like, what we need to do is allow people to buy across state lines. What the government does with this so-called public option that they're talking about, they will end up knocking out the private insurers. What we need to do is to fix the problems with the private insurers and give everybody the opportunity, just like the people who are in Congress, the Federal Employees Health Benefit Program. They can choose from an array of choices. If they don't like their choice, they can change at the next enrollment period.
But as you know, the current AMA supports the president's legislation, and a recent poll found that 70% of doctors actually support a public option. Why do you think that is?
Well, it depends on what poll you're looking at. I don't believe that 70% of the doctors support a public option. I know many doctors are upset with private insurance in their community when the insurance company has so much power and so much market concentration. But the things that we're advocating at the Coalition to Protect Patients' Rights and the thing that Dr. Plested and Dr. Johnson, these are all policies of the AMA. We were there for many years and still go into the House of Delegates, the policy-making body, the fact that we need medical liability reform, the fact that we need the right to privately contract, no more price fixing by government. We need to allow people to own their own insurance and buy across state lines. All that is AMA policy. So we were surprised to see AMA come out and endorse H.R. 3200, the House committee bill, and give their support to the finance bill, which we haven't even seen the Senate finance bill, all the details, and I believe that there is devil in the details.
Dr. Krauthamer, I want to bring you in on this. What's your response to Dr. Palmisano's argument that Medicaid patients have trouble finding doctors and that Medicare is going broke, so why add another public government insurance option to the mix?
Well, thank you so much for having me. One of the great things that is in the reform bill but doesn't actually get talked about enough is an incredible investment in the physician workforce. So an investment in physicians like myself in primary care that do most of the heavy lifting of medicine in this country. So there's a huge investment in that in this reform bill that's moving through Congress. So that's one very important issue that I wanted to bring up. And secondly, so I want my patients to have choices, and I want them to have options, and I want them to have low-cost options whenever possible. For example, in the state of Georgia, 60% of the state of Georgia is controlled by one insurance company, WellPoint. And so I want to add more choices into the mix. So if a public option gives my patients more choice, that I'm for that, and at a lower cost. And then finally, in terms of those physicians who support things like a public option, the New England Journal of Medicine, the most prestigious journal that physicians turn to for their information, reported this study and the survey showing that physicians really are in favor of this reform. I think that's why you see physicians standing together, united yesterday at the White House in favor of this reform.
So I know that the public option takes up a lot of oxygen on this issue. It certainly does here on Capitol Hill, and I'm wondering for doctors, when you take that issue off the table and look at the rest of the reform package, how much agreement is there among doctors on the rest of reform? And there are a number of significant elements to it. Dr. Palmisano, are there other things in this health reform package that you think doctors agree are worthwhile?
Well, I think everybody on both sides of this debate, I think everybody wants to have the patient be in control. I think everybody wants to make sure that the uninsured have the opportunity to have insurance. I think we're all in agreement with that. I mean, we are in the medical profession. We're caring professionals. We want to help people. But we maintain that the government plan that's being put forward, there are other bills that don't go in this direction. I'll give you the jargon, H.R. 3400, Representative Price and his colleagues. That's one that looks at the tax credits and so on. And so what we have here, when she mentions the Georgia experience of market concentration, there's a way to fix that in the competitive model. When you use a public option, the competitive model would be to buy across state lines, buy in another state. If you have the public option, that's the referee in the football game, and the referee moves the goalpost. In other words, you're playing against a team that has its own referee. And what they can do, will they have the same burdens as the insurance companies in that state? Will they have to go with the state mandates? No, the federal government won't have those same mandates. And worse, the federal government will set the rules who can compete in this public option type in this consortium of insurance companies, including the public option. So we're worried about health savings accounts, a very reasonable way, a low-cost way for people to be in control of their own health care and be prudent purchasers.
And Dr. Krauthamer, I have heard from physicians that they are frustrated that there are some major areas that they don't feel are attacked sufficiently with the healthcare reform proposals, things like medical malpractice or defensive medicine. Do you see more that could be done that Congress basically isn't touching at this point?
So our healthcare system is very complicated, and I know as a physician that this bill is not going to be the silver bullet to fix all things that need to be fixed in our healthcare system. But I think it's an important step forward. I think that our patients are far too often hurt by the system that currently exists. I think that this reform make sure that they're not going to be hurt in the future, takes important steps to bringing more access, lower cost, better quality. I think there are definitely more things that we need to do in terms of incentivizing the time that physicians spend with their patients, more about medical liability and defensive medicine. We've seen first steps in the right direction, and I applaud those first steps, but I know there more needs to be done. And but just because we're not going to fix every single problem doesn't mean that we're not addressing very crucial and necessary things that are wrong with our system right now.
Dr. Krauthamer, I can't let you go without asking you about something kind of quirky that happened yesterday. Doctors, the 150 doctors who were there at the White House, were told to wear their lab coats. Some of them forgot or chose to wear something else, and so your organization actually handed out lab coats to those doctors so there would be kind of a uniform look, and that activity got a little bit of attention. Do you wish now in retrospect that you hadn't done that because of the negative attention that it got?
Well, we absolutely did not hand out white coats. All of our doctors brought the white coats that they wear every day when they're working hard to take care of their patients, and frankly that discussion insults the hard work that they do every day taking care of their patients. And I'm sorry that it's distracting from the important point that, you know, our system's broken, our doctors know it, and we need reform this year because it's an emergency.
But the White House says the lab coats were handed out.
So all of our doctors from Doctors for America brought their white coats embroidered with their names, with their institutions from home. So, you know, and it's insulting to me that we're even having to distract from the hard work that they do every day to talk about this, because I think the real issue here is to say that physicians stand in support of reform.
Point taken. Well, thank you both of you so much for
Nancy,
coming
can I
on
just
today.
say, yeah,
Dr. Palmisano,
Nancy,
yes?
I have one quick thing. First of all, let me just thank you for having me on the program, and my colleague. I just want to make the point that primary care physicians are very, very important. And the way that we increase primary care physicians is to allow them to be paid properly so they can give the care needed to their patients. And the way you do that is not by the government taking it away from the neurosurgeons or the obstetricians, taking it from the specialists, is to allow people to privately contract with their patients. So whatever the government pays, then the patient and the physician can make up the difference. That's the American way. That's the free enterprise system. Thank you very much.
There's no one who would disagree that primary care physicians need more incentives to go into the field, because it is such a valuable field. Dr. Krauthamer, Dr. Palmisano, thank you both so much for joining us to talk about the issues today.
Thank you.
Thank you.
Moving on, President Obama made his first trip to the McLean, Virginia home of the National Counterterrorism Center earlier today, where he was expected to promote cooperation between intelligence agencies. This morning, the Washington Post reported that after the president was informed of the case of Najibullah Zazi, his interest was piqued and he was briefed 3 or 4 times a day on the suspected terrorist whereabouts. 3 or 4 times a day. Administration officials are making a point of noting that while the president was highly involved in the investigation, that he did not raise the national terror level. Joining me now to talk about this is CBS News' national security advisor, Juan Zarate. Juan, thank you so much for joining us.
My pleasure. Thanks for having me.
So obviously the implication of this article is that the administration is trying to set itself apart from the previous administration, trying to make the point that perhaps that administration raised the terror alert unnecessarily. As a part of that former administration, what's your response to that?
Well, first and foremost, I'm a CBS News analyst, so I'll give you my objective view, but I think this is a little bit of spin, frankly, coming out of the White House, in part because the reality is the FBI, Department of Justice, and others wanted to keep this very low key, in part because the Zazi case was taken down prematurely. Admittedly now, the FBI would have wanted to have watched Zazi and perhaps his co-conspirators much longer, and in fact, the case is not yet fully wrapped up. The FBI and the intelligence community continue to try to figure out what the ultimate scope of this network looks like, what the plot entailed. And so for the White House to come out and say that they kept things quiet and downplayed things, I think is a little bit of a spin to what the reality was, which is they're trying to keep things relatively quiet to figure out what's still at play.
Being briefed 3 or 4 times a day sounds like a lot. Is it? Are presidents routinely briefed even on important matters that frequently?
Not really, unless you're getting to a point of fruition or crisis mode. And in this case, authorities were very concerned about Zazi, given the fact that they thought this was a very real plot, a plot directed out of Pakistan from al-Qaeda senior leadership, with Zazi having been trained there, having traveled there in the past. And so it's not uncommon for the president to get at least daily briefings on the status of the investigation. I wouldn't overplay the term briefing, because I think what likely happened was an update, maybe with a phone call, or maybe an update from the chief of staff or John Brennan, the counter-terror advisor, simply to let the president know that things were in hand and that the FBI was on the job. And so I wouldn't overplay this notion of 3 or 4 times a day for a period of weeks. I think the president and the former president, like him, enjoy the briefings they get from the intelligence community, the law enforcement community, and follow the cases that are important.
Zazi traveled to Pakistan, as you know, and he's, of course, not the only lone wolf, homegrown would-be terrorist that we've seen. How concerned should the White House be about other Zazis here in the U.S.?
Well, what makes this case different is that he appears to be not a lone wolf and not necessarily homegrown, unlike other cases we've seen in the past, like the Fort Dix plot or the Brooklyn cell. This is an individual who went, we believe, to Pakistan and connected with al-Qaeda leadership, was trained there. And I think it's one of the big concerns that the authorities have, that they are not exactly clear yet as to who he was associated with, who he trained with, and who still may be here in the U.S. As part of that network. And I think, again, the White House needs to be a bit cautious here because I think the case isn't fully wrapped up, and I think we don't yet have a full picture as to who Zazi was working with and what the plot entailed. They're feeling more and more comfortable, clearly, and I think this article in the Washington Post reflects that level of comfort. That said, I think it's a little bit too early to do a touchdown dance in the end zone because it's not a done deal yet.
Got it. Juan Zarate, CBS national security analyst. Thank you so much for joining us today.
My pleasure.
And that's it for Washington Unplugged. Thank you for joining us. You can catch us every day at noon here at CBSNews.com. I'm Nancy Cordes. Have a great day.